Welcome back. Ovarian cysts affect upwards of 3 million girls and women every single year here in the U.S. We have Dr. Salim Surani for 3-Star Health joining us on this Thursday morning to explain more about this condition and why does it affect so many women?
You know, one of the things is it's very, very common. 8 to 18% of the women are affected. It mainly affects them in the reproductive age period. So normally what happens is when you're in this reproductive cycle, your ova is formed and it's in the follicle, and the follicle kind of releases the ova. In some cases, it fails to release, and when it does that, what really happens is that it creates a lot of fluid in there, and that is what we call ovarian cyst. So most of the cysts are benign. Some of them can turn into a cancerous form, or some of them can be dermoid. But most of the time, people have to be aware it's a simple benign cyst. Pretty much 20-30% of the female will have it once in their lifetime. It just goes by itself in a couple of months.
And so what are the symptoms? How would a woman know that she has these cysts?
One of the things is you will feel like bloating, abdominal discomfort, pelvic pain. You can feel nausea and vomiting, some breast engorgement. You also will feel pain during the menstrual cycle. Those are the key symptoms. And diagnosis is very simple. If you see your doctor, that can be diagnosed by the physical examination. But in some cases, what you do is you actually do the ultrasound, and it can show that you have a cyst.
Oh, wow. And so then how are they removed?
Most of the time, you have to do nothing. It just disappears within 3 months. So it forms in, and then it just dries up and it gets better. But in some cases, it persists. And in those cases, if they're having a recurrent cyst and your symptoms are having a challenge, you can actually use an oral contraceptive that can help, because when we do the blood test, you're checking your hormone level, and in some cases also we check the one of the tumor marker, because some of those cysts can be malignant, and that is a concern. So if your pain is persistent, it's symptomatic, especially if you have a first-degree relative who have a breast or ovarian cancer, or you have a breast cancer, there's a high risk that it can be cancerous, so you definitely need to see your doctor.
All right, you got it, Dr. Surani. Thank you so much for visiting us on this Thursday, and we'll see you again next week.
Hairstyle.
Looking good, looking good. I'll see you next week.